sometimes it could actually look like autoimmune hemolytic anemia, but the difference is there's no antibodies from the patient's body destroying the red cells. It's the valves that are destroying.
So those antibodies are things that our body produces that abnormally will start eating up or causing our cells to be eaten up. So we talked a little bit about blood loss that can cause anemia. We talked about problems with the bone marrow that doesn't produce enough blood cells. We talked about the body destroying too many blood cells. These are all things that can lead to a low blood count, and you can help them as a hematologist diagnose and treat these issues.
And make them feel better, because patients with anemia don't feel well. They're tired. They feel like an elephant is standing on their shoulders. It's like walking with weights on you. You just have difficulty moving. People get palpitations. People get headaches. They get chest pain. Because remember, blood, it has oxygen. Blood carries oxygen. When you have low oxygen, the parts of the body that are muscular require oxygen.
Right,
so the heart is a big muscle.
Not enough fuel in the tank to give energy, or oxygen in this case, to the vital organs.
Correct. So people who already have some heart disease or poor circulation to the heart, now you cut down the amount of oxygen the heart is experiencing, they'll get chest pain. They won't feel well. And anyone whose hemoglobin drops too low or too quickly, they're going to have more symptoms: shortness of breath, fatigue, tiredness, all these things. And it's a big effect on the quality of life. Getting back to what we talked about earlier, the quality of life, how happy people are and how miserable they are depends on the hemoglobin.
Right. So things to look out for the viewers are weakness, fatigue,
paleness,
dizziness when you stand up, and some signs of bleeding. If they're bleeding in the intestinal tract, could be black or bloody stools. Their poop can look abnormal. So it's important that you touched on some of those signs of anemia, especially that fatigue and weakness that folks should definitely see their physician if they're experiencing. There's another big topic out there I want to cover today for our viewers, because we hear about it a lot. We've heard about it with celebrities or people in the news who have suffered from what we call DVT. And we see commercials all the time with famous celebrities on TV talking about how they're on a certain blood thinner, some of the newer blood thinners that are out there. And DVT, which is deep vein thrombosis, a big blood clot that can form in our veins, can be tragic. It can actually kill people, and we've seen this before. Luckily, with technology today and people recognizing some of the symptoms, we can treat them for this. Tell us, what are some of the signs of a deep vein thrombosis, a clot, a blood clot somewhere in the body?
Well, sometimes there are no signs. Sometimes patients may have blood clots and not even know it, and it can cause sudden death when the clot in the feet travels to the lungs. That's how it kills you, by traveling to the lungs. When you do have signs and symptoms of blood clots, typically it's pain and swelling in one foot versus both. Now, you could have swelling and pain in both feet, and that's even worse, because that could be a sign of having clots in both of them. And also, if the clot comes to the lungs, they'll have symptoms referable to the lungs. Patients would have trouble breathing. They may get chest pain. They may get passing out. And usually when it travels to the lungs, it's an emergency. They really need blood thinners. And it's also important to understand that the blood thinners that we give, they don't dissolve the clot. They just prevent more clot from forming. The only way to actually dissolve a clot is a medicine called TPA, and that's rarely used. The typical drugs we use are to prevent further clot.
Right, so if someone has some of the signs and symptoms you described of a deep vein thrombosis, of a blood clot, is a swollen or painful leg, could be both legs, shortness of breath, God forbid, if this is traveling to the lung. As you said, that's an emergency. People can die of this, and that's what we see. Sometimes folks are on a long airplane ride, they stand up, they start walking off the plane, and down they go. And one of the first things you have to think of is a blood clot. So what are some of the causes of a blood clot, of a deep vein thrombosis that we just talked about?
Yeah, well, sometimes there's hereditary predispositions. So when a patient comes to me with a blood clot that comes out of the blue, in other words, they didn't have surgery, they weren't lying in bed for a long time, they didn't have an injury to the foot, then we start working up a genetic predisposition.
Meaning that they inherited some disorder from their parents?
Correct.
Right.
And the way we test for it is blood tests. I check for a whole battery of tests, and that will tell me.
And what happens if one of those comes back positive, if you find a genetic problem in the family?
Well, first, you'd want to definitely check other family members, because they need to be alerted that they're at risk too. Remember, this is a disease that patients could die from. And unfortunately, there have been deaths in very young people with this condition. The other thing is they need to take precautions to prevent the clots that they already have from coming back again. So if you have a blood clot, you already have a high risk of getting another blood clot right off the bat. Now, if you have a genetic predisposition, your risk increases significantly more, depending on which predisposition you have.
So one of the causes, genetic. Some people can have a problem with their DNA and they form more clots. What are some other causes? What are some of the most common causes of DVT or deep vein thrombosis?
Well, the other thing that could cause it, for example, is having cancer. So now when someone's older and they've never had a blood clot in their life, there's no family history of a blood clot, they're less likely to have a genetic predisposition, but it doesn't rule that out completely.
So you'd still get genetic testing, but here you're thinking maybe there's cancer causing it.
Right. I may not even check genetically if they're, depending on their age and depending on my level of suspicion, but I would have a much higher index of suspicion for cancer.
Right. So cancers can cause deep vein thrombosis. We talked about genetics.
And they need to get their age-appropriate cancer screenings.
Cervical cancer, breast cancer,
and
colon.
colonoscopy.
Right.
Yes.
So let's talk about some other causes, because we hear about on the news, for example, back during the Iraqi war, when David Bloom, one of the reporters, was in a tank and he was sitting for a prolonged period of time and passed of a DVT. We hear about people on airplanes. So tell us about this issue with not moving, and how does that contribute to forming a DVT?
Well, there's something called Trousseau's triad. There are these predispositions. There's an injury to the vessel. There's a stasis. These are all the things.
Stasis meaning there's less movement?
Less movement of the blood. And in fact, sometimes people ask me, well, what do I do to prevent blood clots? I'm traveling a long flight to Europe, and what do I do? And I just pretty much give them some common sense advice. I'll say limit your alcohol intake, because alcohol is diuretic, meaning it gets you to run to the bathroom. And it could dehydrate.
It dehydrates you.
Likewise with caffeinated products. We all drink caffeine. We're running around all day, right? Notice we're always running to the bathroom. And also to get up. I'll tell the patients to set your watch timer on the hour, every hour, get up and move around in the airplane.
Yeah, that's very important also, right? So sitting for a long time, set something like your phone or your watch or something to remind you to move. That's important.
Yep. And these things do help. And also, if they have a blood clot history in the past, I'm even more cautious. For example, someone who's had a DVT in the past or a pulmonary embolism, they have to be extra careful because they're really at higher risk for another clot.
So having a clot in the past really places someone at a higher risk for having one in the future. So let's talk about and review that for the viewers, how to prevent DVT, deep vein thrombosis, avoid the alcohol on an airplane, avoid the caffeine, stay well hydrated. As you said, dehydration is an issue.
And move around.
Move around. And this doesn't only apply to an airplane, but other areas where we may be sitting in a long car ride or a bus ride, train rides. These are important tips that you're bringing out for our viewers.
And another little practical tip, if they can't even get up all the time, I'll tell them to just do isovolumetric kind of exercises sitting in the same chair. For example, they could put their foot against a resistance against the chair in front of them and just squeeze.
So
press
squeeze
up and
down on the calf muscles.
Exactly. And that way circulates the blood, and they're not really getting up, but they're still increasing their circulation.
Great tips to talk about DVT, and I know you treat thrombosis and clots in your practice. I want to, because it's March and we're getting a little short on time, to touch a bit on colon cancer. I know you treat many, many patients with colon cancer. Tell us what is new in colon cancer treatment these days. Patients who get diagnosed with colon cancer, how are you approaching them, and what new treatments are there on the market?
Well, there's been a big explosion in general in oncology and treatments. We have what they call immune therapies. We have targeted therapies. So the first step is to know what's the stage of the cancer. So, and I kind of keep it simple and divide it into early stage, locally advanced stage, and metastatic. Metastatic meaning it's spread to distant areas and really it's not curable.
So locally, that means we can cut it out, and hopefully if it's at a low stage after surgery, they won't even need chemotherapy. Correct. But for the viewers today, they've been seeing these advertisements on TV for some of these newer agents that you're talking about. What is new for someone who unfortunately may have advanced colon cancer? Well,
when they have advanced cancer, what we normally do now is we genotype the cancer. We run certain tests to tell us the genetics. And then the genetics then help us determine what's the appropriate treatment. So when I have a patient with colon cancer, first I look at whether it's on the right side of the colon or the left side. Some treatments are more effective on the right, some treatments are more effective on the left. I look at whether they have what we call an EGFR, I look at what they have, I look at if they have what they call RAS mutation.
So these are genetic markers, and you're able to, by location, by looking at these genetic blood tests or tests on the biopsies, to detect targeted therapies different from what we've dealt with in the past. So there's hope today, more hope at least, for patients with advanced colon cancer. So in our last few seconds here on the show, Dr. Blokh is a board-certified hematologist-oncologist here in Brooklyn, treating anemia, treating blood clots, cancers, colon cancer, as we just discussed. He has been in Brooklyn for nearly his whole life and is a fixture in our community. And I want to thank you for coming on the show. It's important for our patients to get screened for cancers, breast cancer, for colon cancer, all of the age-appropriate screenings that their primary care doctor can sort of arrange for them. So for our viewers watching today, any last pointers you want to give to them, take-home points for our viewers today?
I want to differentiate between the liquid cancers and the solid cancers. The liquid cancers, you either have it or you don't. And if you have it, it's in the blood and it's all over. For the solid cancers, timing is critical. You have to get your age-appropriate cancer screenings. On top of that, if you have symptoms, you have to see a doctor and get it evaluated. If you catch the cancer early, most solid cancers are localized. They're not in the blood yet. You could cure them. You could cure the patient with surgery. Once the cancer is spread and it's spread distant and it's metastasis, the cure rate is unlikely or significantly less likely. So timing is critical.
The message is early detection.
Early detection.
See the primary care doctor.
Symptoms.
Ask your primary care doctor, am I due for any cancer screenings? What can I do to prevent cancer? Because as Dr. Blokh is telling us today, early detection is just so important. Thank you for your interest in the show and your desire to become more involved and educated about our health. Please visit us at Medcastplus.com or on social media. Thank you for joining us today. I'm your host, Dr. Jack Braha. Stay healthy, Brooklyn.